We're very excited to bring a lot of the expertise and a lot of the physicians and team members from Columbia to the region to allow for collaboration between Garnet Health and Columbia so that the patients here can benefit from the same expertise that patients at Columbia have been deriving benefit from for many years.
There's an excellent hospital here, so patients don't have to travel an hour or 2 hours away to get a therapy when they can get it locally and have their family around and make it much more simple to access care. My name is Susheel Kodali. I'm an interventional cardiologist specializing in valvular heart disease, and I'm a professor of medicine at Columbia University.
My name is Mahesh Madhavan. I'm an assistant professor of medicine and interventional cardiologist at the Columbia University Medical Center.
The goal is to treat patients with valvular heart disease through less invasive approaches. Rather than conventional open heart surgery, which for many patients can be higher risk, it's a long recovery, we can treat patients through catheter-based approaches where they can leave the hospital in a day or two and get back to their normal lives. The patients are generally older patients in their 70s, 80s, and even 90s, patients with severe aortic stenosis. And these are patients that are generally very symptomatic. They're shorter breath, their quality of life is really limited.
I think we can all appreciate the fact that there are a lot of patients with extensive pathology and severe disease states that in many cases we're not necessarily getting the treatments that were available to people elsewhere. And so the hope is to bring these treatment options to patients in the region.
The team here that's coming to provide care has done thousands and thousands of procedures. And it's not just one person, it's the interventional cardiologist, it's the cardiac surgeon, it's the imager, it's the nursing team, it's everything, every aspect of it. The goal is to provide that same level of care that they would get if they were at an institution that's been doing this for 15 years.
The facilities here are state-of-the-art. You can see we're in a brand new hybrid OR room where patients are going to be treated. And afterwards, they'll be followed in a state-of-the-art CT ICU where the nurses and team members are all trained by those who are experts in the field.
I mean, part of putting patients at ease is explaining what's going to happen, and also but reassure them that we've done this before. We've done many patients like them. We've done patients in their 90s, even patients over 100 or 80s, and that this is not the first time that we've done this, and we feel very comfortable that they're going to get an excellent outcome.
We have a heart valve clinic here where patients, meet the interventional cardiologist and the cardiac surgeon and hear about the treatment options. Patient navigator, kind of going through the process of what being treated with a transcatheter treatment approach would look like. And we have a valve clinic coordinator who will be helping the patient every step of the way. I've had the opportunity to kind of work with a number of people who have been pioneers in the field and to learn from and work with them over the years and now continue to do similar type work. It's really rewarding to see the patients kind of benefit from these technologies and techniques to hopefully get back to their day-to-day lives and feel better soon thereafter the procedure.